Okay, it's guess we can open the meeting. Everyone can hear me?
Yes.
Good. Uh, so this is the Board of Public Health Zoom meeting, Tuesday, February 11th, 2025 at 6 p.m. Members of the public may join the meeting through a PC, Mac, iPad, iPhone, as I'm doing, in several ways. It is a virtual meeting, and per laws of the Commonwealth, all votes will be roll call vote. And tonight's meeting will be, I suspect, fairly short. I'd ask for roll call. Elizabeth Kirkpatrick.
Elizabeth Kirkpatrick present.
Marcia Lewis.
Marcia Lewis here.
Paul Schubert here. The meeting is open. And first up is 34 Rocky Lane upgrade septic system and Morse Engineering. And I think we're waiting on Morse Engineering. Are you there?
I don't think he is here yet.
Okay.
We could just do something else and just come back. And then if not,
Sure.
I can just present it and then we can just vote on it.
Sure. So why don't we go to the grant approval intermunicipal agreement. You want to take that over?
Sure. Let me get this plan out of the way. I'm gonna share my screen. Oh, wait, here's Paul.
Okay.
We'll skip this.
Okay, that's fine. So we'll go back to 34 Rocky Lane upgrade septic system, Morse Engineering. Is Morse a representative for Morse Engineering present?
Paul, you there?
Hello. Can you hear me?
Yep.
I can, yep.
Okay.
So this is the Board of Health meeting, February 11th, Tuesday, 2025. And you have the floor for Morse Engineering for 34 Rocky Lane upgrade septic system. Just introduce yourself for the public and the committee.
Absolutely. So my name's Paul Gunn. I'm a civil engineer with Morse Engineering, representing Christian Davis for the new septic system that is part of the raise and rebuild at 34 Rocky Lane. So this site currently contains a 3-bedroom single-family dwelling that is served by a conventional leaching trench in the rear yard. The site's not located in any special DEP overlay zones, though about half of it lies within 400 feet of Sanctuary Pond. The applicant is proposing to raise and rebuild the dwelling, and as part of that, we are going to abandon the existing septic and install a new 5-bedroom septic system, which makes use of 2 different innovative and alternative system components. The proposed leaching field would consist of 5 rows of 8 ARC36 infiltrator leaching chambers. And because this leaching field lies within 400 feet of Sanctuary Pond, rather than a conventional septic tank, we have also proposed a microfast treatment tank to provide the required nitrogen removal in Cohasset's bylaws. We have also provided a conventional primary and reserve area that have been shown on the plans per the requirements of the DEP approval letters for infiltrator chambers. I believe that's all I have. I'll turn it back to the board for question and comment. Thank you.
Okay, does anyone have any comments from the board? I'll take that to be no. And can everyone hear me?
Yes.
Yes.
Okay. So then I will move for a proposed motion if someone would be willing to make a motion to approve the septic system design plan system for 34 Rocky Lane, Cohasset, Massachusetts, prepared January 7, 2025, as presented February 11, 2025.
I'll
Is there a
make a motion to approve the septic system design plan system for 34 Rocky Lane, Cohasset, Massachusetts, prepared on 1/7/2025 and presented today, February 11th, 2025.
And is there a second?
I second.
Any discussion? And we'll go to a roll call vote. Elizabeth Kirkpatrick,
Elizabeth Kirkpatrick, aye.
Marcia Lewis,
Marcia Lewis, I.
Paul Schubert, aye, and the motion passes unanimously. Thank you so much for the presentation, and have a good night.
Yeah, thank you. Have a good night.
Next up is the PHE grant approval for intermunicipal agreement, and I'll turn that over to Pam.
Okay. So this is something I've been, writing about my weekly reports for a long time. And so we are kind of like up against it now. The reason why this thing got delayed so much is because, honestly, because of the fact that the Cohasset Select Board was suing the Situate Select Board, and so it really wasn't a good time to go before the select boards and ask them to sign this. At least it didn't seem like it for a little while, but enough time's passed, and we really have to get this agreement signed because the state is now literally withholding money from us, which it's not a great time to be having that happen. So just a little bit about what's going on, where whole South Shore Collaborative is about. It started, all the collaboratives started because in 2019, the Massachusetts Special Commission on Local and Regional Health, they released a study, and it was provided recommendations on how to strengthen local health departments. Unlike most of the country that has, big county health departments, in Massachusetts, like all 360 plus towns have their own little health department, and a lot of them really weren't meeting the requirements of getting inspections done and things like they were supposed to. So they thought the best way to do it maybe would be to combine resources and share resources and, help each other to get things done. So we kind of jumped in the beginning. They gave out these grants in waves, and because we were early on, we got a grant for only 3 towns, Situate, Cohasset, and Hingham. And it turned out to be lucky because as time went on, the groups got bigger and bigger and bigger, and everybody receives the same amount of money. So we received the same amount of money as, for example, Quincy, Braintree, Randolph, Holbrook, Weymouth. That's 5 towns. They receive the same $433,000 a year that we do, which is crazy, but that's the way it works. So because the state's giving us so much money, we have to really get this formal IMA signed. So again, the municipalities and leads, it's me and my counterparts, Susan Sarney and Andrew Shealy from Situate, Susan from Hingham. So the staff that we've hired, because our 3 towns have actually done a really good job of keeping up with inspections. We do all our food inspections and septic inspections and plan reviews and things. But one thing we were really missing were mental health services and just social work services. So we hired Stephanie Saunders to be our regional social worker, and Samantha Joyce, who was at one point an intern under Stephanie. She's our regional community health outreach worker. So where Stephanie does casework, Samantha is more like connecting people to services, people that need housing, they have food insecurities, they need heating help. And then there's also a social work intern that keeps rotating in and out. And then we also have a regional public health nurse. Her focus is more on like educational type stuff, which I'll get into a little bit more in upcoming slides. But she's also really good at helping to cover Maven, which is a big thing when people go on vacation and stuff. So in terms of accomplishments, it talks again about the staff that we've hired, but in terms of inspectional help, Cohasset and Situate, we weren't doing our tobacco inspections like we were supposed to, so we've hired a contractor to do that for us, so now we're all in compliance. Hingham was struggling. They have almost all septic. Well, I think they're like 60-40 septic. which is a lot in their town. So they've got a contractor to help them do Title V inspections and plan reviews. We bought Permanized inspectional software. We have iPads. So now this past year in 2024, for the first time, we did all our inspections on iPads and loaded them up to the computer, which is great, cut back on paper. And we have Boston University doing a regional community health needs assessment for us. Some of the community health education that we've done is skin cancer screening, tick prevention, suicide awareness, biohazard safety, cyber safety. The hoarding was really good. That was not just that was for not just like the people within our little group, but we had all 3 towns come together for an in-person training. We had social workers and health directors and police and fire. We also did 8 hours of online training. And then there was a specialist who had a group with people suffering from hoarding and had their own like behavioral health course. So that was really, really good. So a lot of the same stuff, finishing up that community health needs assessment, continue with training for, you know, everybody, nurses, health directors. We're going to launch our own website so that we can put like communications and videos of classes and things like that, health resources up there. One of our big goals is to do a maternal health and child program to improve health access and well-being services for new mothers and infants. But the number one thing is we really got to get this IMA signed as soon as possible. So that's kind of an overview. And so tonight I'm just looking to get the board to vote to approve signing this thing. It should be awesome. And one of the logistical problems is that we have the 3 towns and it's going around and like our lawyer does it and then another lawyer looks at it and then they have changes and then the other lawyer has changes and trying to get like a finalized version. I think we're just about there. The copy that I sent you tonight is probably like 99% done. There could be people that might make minor wordsmithing changes, but there'll be nothing substantive at this point. So maybe if you approve it, you could say something like, we approve it and I don't know, even though there may be some grammatical changes or something. I don't know. I'm not quite sure how to say it, but maybe you don't even have to say that. I'm not sure.
Yeah, I mean, we can always say approval, provided there are no substantive changes to be
Yeah.
inserted at a previous date.
Yeah, that would be good. Or future date.
Sorry, future.
Yeah. Let me stop sharing here.
So I got onto the computer finally. For some reason, it was a little glitch there. So I can now see everyone. So this is basically has been in the works, as Pam said, for a while, and now it's getting ready to be implemented, which is great. Is there any discussion from the board? Great. And with all that work that's been done, it's now to the point we can make a motion to approve. So I'd ask for a motion to approve the signing of the intermunicipal agreement prepared for the PHE Excellence Grant between Cohasset, Hingham, and Situate. Is there a motion?
Sure, I'll make a motion to approve the signing of the IMA prepared for the PHE Excellence Grant between Cohasset, Hingham, and Situate, with the understanding that there may be a finalization with no substantive changes coming forth, but we approve it as of today, which is February 11th, 2025.
Is there a second?
I'll second that.
Roll call vote. Elizabeth Kirkpatrick,
Elizabeth Kirkpatrick, aye.
Marcia Lewis,
Marcia Lewis, aye.
Paul Schubert, aye. The motion passes unanimously with that proviso. We'll see if there's any substantive changes that'll come back to us, but I suspect it looks like it'll be a a signed document, head back to the respective towns and get implemented, which is great.
Yeah, that's
Um,
great. Thank you so much.
That's
Yeah,
great.
thank you everyone for doing all the work. That's a lot of paperwork and a lot of work to get done to this point, which is great to see. So next up is approval of minutes for January 7th, 2025, Board of Public Health, Town of Cohasset. Any discussion? I'd ask for a motion to approve the minutes of January 7th, 2025, Board of Public Health, Town of Cohasset.
I'll make a motion to approve the meeting minutes from January 7th, 2025, Board of Public Health, Town of Cohasset.
Is there a second?
I second.
Roll call vote. Marcia,
Marcia Lewis, I.
Elizabeth,
Elizabeth Kirkpatrick, aye.
and Paul Schubert, aye. Motion passes unanimously. Next up is the next. Let me bring up my schedule. And the dates is the next date of the meeting, and down there. So March. So I don't think I've got any. I'm not going to be away on March. So any particular time is good? Is the 4th or 11th good?
Either works for me.
The 11th is better for me.
Okay. 11th is fine with me. Pam?
That's fine.
Okay, so let's pencil in March 11th at 6 p.m. for the next meeting. All right, and next up is the Public Health Director's report.
I guess the biggest thing is that we are really far behind and I'm trying to launch that inspectional housing program. But I think at long last, this end of this week, I think we may finally get our application software up and running. We saw today there was a test on there. And Amy filled out pretending she was an applicant for like a housing inspection, and it seemed pretty good. The certificate of habitability that you produce at the end had some changes that we needed to make, and I marked it up and sent it out to them. But I think we're almost there finally. And luckily, Amy's been really compiling lists of all the different rental properties in town. So we'll be ready to launch a bunch of letters next week and really get this thing kicked off finally. So that's about all I have.
Okay, excellent. And next up is the Public Health Nurse report. All
Hey,
yours.
everybody. I don't have a lot. I just wanted to just mention that I'm sure most of you have heard, but flu activity in Massachusetts is about as high as it can get. Well, I shouldn't say as high as it can get, but as far as levels go, we're at very high, which is the highest level. Fortunately, in Cohasset, we're not doing bad at all. I think I ran a report this morning and we've had 5 confirmed cases so far this month. So that's not a lot. We had 11 total last month. And still a little bit of COVID out there. We've had 5 reported cases. On that note, we have again run out of those free COVID home tests. I did order another 540 kits, so or tests. So those are available free to any resident who needs them. They're in the lobby at Town Hall. Longtime Dr. Pompeo, Cohasset physician, has retired at the end of January, so I'm hearing from quite a few of his patients that are still searching for new physicians. So just trying to help them out as I can with B12 shots and any questions they may have. You know, a lot of people are asking, where can I find a new primary care physician? They're having a really hard time. So helping out there if I can. Increase in office visits at Town Hall for just a variety of things, medication questions, a lot of blood pressure checks, weight checks. So that's good, just getting to meet some more of the residents. And then I'm just working on securing vendors for the upcoming recreation fair, which is on March 23rd from 1 to 4 at the Dare Hill School. And then other than that, Pam and I don't know if you mentioned it, Pam, we went out and did our first rental inspection today. That was exciting. Went well. And I think, you know, once it kicks off, I think we're we won't have any problems with that program. I think it'll be good. That's about it.
Okay, great. And I just to kind of harp on the flu numbers, within the last month, we've seen a tremendous numbers of influenza A, a little bit of influenza B, but mainly influenza A at South Shore, which is kind of our local hospital. And it's been, quite an uptick, which normally you see the uptick right after, Christmas and New Year's. This is a little bit of a late uptick, but the other thing, they're trying to send some of the influenza A to the state to look to see if there's any correlation with bird flu, which I have not heard of any bird flu in the state, but that some of these are randomly sent to the state for confirmation if there is bird flu. I'm not aware of any yet.
So Paul, any information on whether the hospitalized patients were vaccinated? My understanding is the vaccine is only about a 50% match, and that could be accounted.
It looks to be, there's a lot of kids that have not been vaccinated this year, so that tends to kind of overflow into the adult population. And the adult population, it's probably about 75 to 80% penetrance of the vaccine. The vaccine was a pretty good match this year, but as with any of the flus, it's still marginal at probably 70% protection. So you do those numbers, and you're probably about right. About 50% will be sick enough to potentially come down with enough symptoms that may get you in the hospital.
And I do, just as a note, I do have plenty of vaccine left. I mean, I've held as many clinics, I think, as I possibly could. I haven't had a request for any vaccine probably in well over a month. But it's not too late. Last year, I saw cases as late as mid to late April. So it takes about 2 weeks to get your full benefit from it. Get it now, you're still protected for a portion of the season.
Absolutely, and particularly because this looks like it's a late second round. Anyone who's not been vaccinated, strongly recommend that they, get the vaccination if there's no contraindication, which, it's certainly better than nothing, but it's, this is a good match, but it's, as with most of the flu, it's still, probably 75% protection. I kind of want to also mention with that vaccination profile, there's an outbreak of measles in West Texas, which I'm not sure if you heard about it, but I just saw on the news feed last night. It looks like there's an outbreak in a relatively under-vaccinated population and kind of in West Texas, and there's about 24 cases as of now, and 9 of them were hospitalized. So this is, what we may see if the vaccination rate drops, and particularly in kids, whether it's measles, mumps, or chickenpox, we'll see that start to show up. And so, keep the if you can, keep the kids vaccinated. I also want to mention, I had a patient who had not been, he didn't convert to a measles vaccine, probably because I suspect he originally had a vaccine in the early 60s when it wasn't effective. He was traveling and he had no measles immunization. So I had given him a single dose, and then he was to come back in, and I said, I wonder what the CDC recommends from a second dose, if you need to do the standard profile or just a titer. And I went on Thursday night to look on the CDC website, and it was blocked for immunization profile for adult population. I don't know what to say. It's from a practicing doc, it's quite frustrating to see the information just not available. It was the site's been moved, so I'm hopeful that will improve, but we may see reporting. For what I worry about is if the bird flu, if it skips and jumps into the human population, that we don't have a way to track it at the federal level, and that may be a problem. Yeah, that's all I have to say.
Unbelievable.
So I think that was the topics I had not reasonably anticipated. I never would have thought there'd be another measles outbreak, but it was declared, measles free, I think in 2001 or 2002, and now it's back with outbreaks around the country.
Do we have any information on immunization rates in the town?
Don't know. I mean, I know that to get into public schools here, you need to be vaccinated for most of the childhood things. I don't know what the times you cannot, you can opt out. I don't know what that is. And Massachusetts are pretty strict.
Yeah, I think that they've loosened it a little bit. I think that you're seeing a lot more exemptions than you had in the past. I can try to look out, ask the school nurses what their rates are. It'd be interesting to know, but I guarantee there are more exemptions than there have been in years past. Unfortunately, because you're right, you're going to see a lot of these diseases that were pretty much, gone have a resurgence. Chickenpox, measles. I mean, TB is a different story, but we're seeing an increase in that as well. We'll
And is
see.
there any role for the Department of Public Health or just to do some informational briefings to this, let's say to the schools? I mean, do we take any kind of active role in trying to disseminate information?
I mean, we can certainly, push it out there, but we can't, there are exemptions for a reason. So you don't really want to force your, or I don't.
Right, right.
I
No, I'm
believe I
just
can
talking about
still-
general information. I'm thinking about that also in the context of H5N1,
Yeah.
should there be a need. I mean, I'm assuming something would come from the commissioner and the state. But, I'm even thinking of within the context of the grant, just to be able to be in a position to provide information to the community if there ever became a need.
Right.
I mean, I'll likely be at the town fair. That's on the 23rd, so I'll try to make that, which is one little spot we can at least make a presence. But you're right. I mean, for measles, it's got to be a 95 plus
Right.
penetration of the vaccine before you really stop it. You can get down to 93%, you start to see outbreaks, and that's, I had measles as a kid, and it was pretty ugly. I had four brothers, and we all had it, and it was, it's not something you want to taunt. So any other comments? So I'd ask for
I just say one more thing though,
Sure.
Elizabeth, and I hope you don't mind, I'm just gonna tell these guys though that you're not gonna run again. So if everybody on here wants to just think about friends or somebody that might want to run for Board of Health. I mean, when's the election? Is May? I think it's May, right?
It's May. It's been a true pleasure. I am maxed out, so and federal employees are back to work. So I'm still waiting on my direction and location. But so anyhow, it's been a pleasure, but it's time for me to focus on my family when I have free time.
Well, thank you for
Yeah.
your time and effort and work and input and brains.
Thank you.
Definitely. So Elizabeth, you might not be going to Boston. They might send you somewhere else.
Well, right now they have us going to Cape Cod because there is room, but I mean, the reality of driving to Cape Cod every day is just not sustainable. And of course, I work in the environmental field, which is very questionable about the long-term need for, compliance or, site investigations, restorations, all of that. So we'll see what happens. But for now, once I get the direction letter, it looks like Cape Cod.
Yeah. I hope that money keeps flowing.
We'll see. It's a wild time.
Yeah.
Well, with that, sad feeling, I think. I'd really like to see you stay, but understand. And ask for a motion to adjourn.
I'll make a motion to adjourn.
Is
I'll
there a second?
that.
And roll call vote. Elizabeth,
Elizabeth Kirkpatrick, aye.
Marcia,
Marcia Lewis, aye.
and Paul Schubert, aye. Motion passes unanimously. See you next month. Take care.
Great.
Everybody,
thank
thank
you.
you.
Thank you.